So I'm Dr. Brian Cameron. I'm a professor of pediatric surgery at McMaster, and I'm director of our international surgery desk within the Department of Surgery. Really, as a medical student, I had the opportunity to travel to Sierra Leone, West Africa. In retrospect, one of the things that sticks out to me as an example of the importance of rural hospitals is that in the compound where I was staying, I noticed that there was a vehicle that was the vaccination program vehicle, which was a broken down vehicle lying in the field that obviously had not been driven for 10 years. And I asked somebody about it, and they said, well, we used to have a vaccination program, but we decided we had to use the fuel instead to run the generator for the hospital. And they felt it was more important to be able to provide cesarean sections, to be able to provide basic surgical care for emergencies in this hospital, rather than to send the vehicle out for vaccinations. And in fact, they probably had it right. When we measure the impact of and cost effectiveness of basic surgical care, such as the availability of cesarean sections, actually that prevents more disability and death than vaccination programs do on a cost effectiveness basis. So that was an interesting experience for me in West Africa. As I said, I came back rather overwhelmed by the need and the challenges there. During my surgical training, I developed an interest in and wanted to go back to that sort of setting. And to prepare myself for that, my first job after finishing training in Calgary was in northern Newfoundland, where I spent a year doing really remote surgery in Canada and learning a much broader breadth of practice, including urology and orthopedics. And that actually was probably the best preparation I could have had to work in a more remote or low middle income country, if you like. Then an opportunity came up to go and teach at the Fiji School of Medicine, where I spent 4 years there teaching surgery. And that really impressed on me the impact that an educational program and really our role as coming from the north as a collaborative partner to help train surgeons. Really at that Fiji School of Medicine, they train surgeons throughout the South Pacific. So when I returned to North America, did my pediatric surgery fellowship, and then had an opportunity to visit Guyana, and I am getting around back to Guyana now. Really I saw an opportunity there to be engaged with education in Guyana. I started visiting, I was doing some medical student education, I was doing a little clinical surgery, working with the local surgeons there. And what I heard from the few local surgeons in Guyana at that time, which would be 15, 20 years ago, was that they were very frustrated by the fact that they would send their own students away to do surgical training, and most of them would never come back. So they said, why can't we start our own surgical training program in Guyana and train surgeons locally and hopefully keep most of them here? So that began in 2006. I was able to organize the Canadian side of the program with the Canadian Association of General Surgeons. And really over the last 15 years, there have been over 20 surgeons trained in Guyana. Almost all are still working there. Some have been able to come up here to do short-term fellowships. And really the standard of surgical care has risen much more than it ever would have with just individual visits by outside surgeons. So it's been a very fulfilling opportunity for me in my career, has helped me to develop really lifelong friendships and really to learn a lot about medical education, surgical education, to learn a lot about myself and how to engage and work with others. And again, my involvement with Guyana continues and really has been one of the richest part of my practice in my life. There are a lot of interest in global surgery amongst medical students and residents now. And I think that's because most people go into medicine with the idea that they want to help people. There's really a global mindedness amongst young people in the current generation that recognizes there's injustice in the world, that there's a great disparity in wealth and poverty, and that there are so many places in the world where there is a great need for medical and surgical care. So I think that many young people going into medicine see that as an opportunity as part of their career to contribute in some way to that, meeting that need. I think that for those wishing to pursue ongoing involvement, it's always the best idea to keep going back to one place and learn about it and be able to contribute and meet the actual needs there. In Canada, I think that the two ways that surgeons do this, one is if they have a compatible group of surgeons that can allow each of them or to take a few months off during the year. Or in an academic center, it can really be part of one's academic contribution to spend a few weeks, a couple of times a year or longer, working in a different setting.